So there's no one evidence-based treatment that's going to cover everything. It's a very heterogeneous group, and we talk often about transdiagnostic eating disorders. So people with severe eating disorders can often cross-sectionally be diagnosed with anorexia, then bulimia, then binge eating disorder, and maybe back to bulimia. And it's about understanding what purpose is it serving in that person at that time. The evidence is that the best type of treatment is whatever the patient can do that helps them feel supported with the person. So the so-called therapeutic alliance is the most important part of any treatment. Second to that, in children, so people under 18 living at home, there's very good evidence for family-based therapy, which is also sometimes called the Maudsley method because it came out of Maudsley Hospital in the UK. But that approach works for families when you basically take the responsibility for eating from the child, give it back to the parents and retrain the child how to eat with the parents' support. And it's very intensive, and it's very, if it's followed and it works for a family, it's terrific, but it won't suit all families or all presentations. There's evidence base for another type of treatment called cognitive behaviour therapy enhanced, or so-called CBTE, which has good evidence for people who've got BMIs over 17.5, who are actively engaged in recovery and treatment. And it's a structured approach to working through how to stop dieting and accept your own body and your own sort of failings and strengths and weaknesses. And again, people who engage with it and complete it have good outcomes. But some people can't engage with it. It's not the right type of treatment. The more unwell they are with their eating disorder, the more you need a multidisciplinary approach. And I always recommend that people have a GP, at least one dietetic review to understand about what would be normal for them, and psychology or psychiatrist who's willing to do psychotherapy, because if they've got an eating disorder, there's going to be a component of psychological dissonance and problem thinking, and the behaviour is linked to the problem thinking.